Welcome to The Explainer. Today, we're digging into a fascinating study out of Australia.
It all starts with a tool originally built to measure wealth inequality. So let's dive in.
You see, public health officials have a tough job. How do you best target rising STIs?
Well, researchers in Australia turned to a really surprising tool, the Gini coefficient.
Okay, so how does this thing even work? Well, it's all about measuring concentration.
Basically, it gives us one simple number, from 0 to 1, to show how unequal something is. In a totally equal world, 20% of the people would have exactly 20% of the infections.
But reality is messy, right? This line, the Lorenz curve, shows the actual distribution.
And that gap between the two lines, that is the Gini coefficient. Bigger gap, more inequality.
Okay, so that's the theory. Now let's see how it played out in this Australian study.
Researchers crunched the numbers from thousands of clinic visits to map out these infection patterns.
And what they found was a huge difference in how these diseases actually spread.
You can see a clear pattern here. Syphilis and HIV were way more concentrated than chlamydia.
So, high scores mean the infections are packed into a small group. Low scores mean they're spread out.
But it gets even more interesting when you start comparing different population groups. Whoa. For heterosexual men and women, the risk for HIV and syphilis was almost totally concentrated.
Okay, so what's the point of all this? How does it actually help create smarter policies?
It basically gives you a roadmap. For high Gini scores, you target small groups. For low ones, you go broad.
So, for heterosexuals, you can focus resources on that tiny group with the highest risk scores.
But for the GBMSM community, with diseases like chlamydia, a much broader approach is needed.
So in the end, the researchers say this tool allows for a really tailored, data-driven approach.
It really makes you wonder, right? Where else could we use a tool like this to solve tough problems?